So, so there are many issues with rare diseases, and they're unique in many cases. So, for instance, if you have patients who have a common disease like diabetes or heart disease, while it's incredibly important to treat those diseases as well, I think there are some issues that are unique with rare. So, for instance, patients being diagnosed. Many physicians have never seen a patient with a rare disease, and so when they come into the office, they can be they're often misdiagnosed. I think 40% of patients are misdiagnosed multiple times before they receive a correct diagnosis, and the average time to diagnosis is about 5 years. So one of our goals at Shire is to shorten that time to diagnosis, to help physicians through digital to become better at spotting rare diseases and referring to the proper specialist and geneticists, because 80% of rare diseases are in fact genetic. So it's unique, it's different, and there's a lot of opportunities for digital to play a role in that. But I do believe in patients having access to their own medical records, to being able to have I would just say more of a say in their healthcare experience. And so that might be empowering them with their treatment plan. It may mean more contact with their medical team. But I think that I'm just passionate about it. I'm passionate about the opportunity to incorporate genetics into healthcare. It's a field that I think is nearly untapped at this point. There are so many things that are hidden within our DNA that can give us clues as to what our future might look like. And so I think that to date we have information coming in from disparate sources. You have people wearing their fitness trackers, you have your EMRs, you have your genetics data, and you have patient-reported data, maybe about how someone feels in a day. To put that all together gives you a more holistic view of the patient and of their health in general, and I think that will be, I think that's limitless.